Public Space Travel is a leftist, anti-capitalist podcast of disgruntled academics, video gamers, and friends. Our belief is that knowledge should be made more accessible and be used for anti-oppression and non-hierarchical revolutionary ends. You can support what we do at patreon.com/publicspacetravel and reach out to us at publicspacetravel@gmail.com or leave us a voicemail at 208-502-1406. Now, on to the show.
Hi folks, it's Lazarus Wolf. Today, in this episode, we're going to be discussing some current examples of the consequences of systemic inequity and the intensification of violence and xenophobia against communities of color due to COVID-19 here in the United States. In particular, we will connect elements of critical race theory, which offers us one such race-conscious approach to understanding educational inequality and identifying potential solutions. We do want to affirm that there are more specificities here to critical race theory that are equally important and necessary for the analysis. Some of these being Lat crit, Black crit, Indigenous crit, and so forth. However, we can only fit so much here in this short podcast episode. So we will provide some links to some further educational resources on critical race theory, which we'll abbreviate here forth as CRT in the show notes. So thank you. Enjoy the show.
Public space travel. Public space travel. And so on and so on.
I can't help but believe that in the future we'll see throughout the world an increasing trend toward the next logical step. We'll achieve full communism.
Public space travel. Public space travel. And so on and so on.
Welcome to Public Space Travel. I'm Lazarus Wolf.
And I'm Lucy.
I'm Lichen.
Rayito de Luz.
I'm Marks.
On April 8th, New York City public advocate Jumaane D. Williams released a statement on the racial disparity in the impact of the COVID-19 public health crisis after the city and state released data showing the fatality rates of the virus by race. For those that don't know, the public advocate position is a non-voting member of the New York City Council with the right to introduce and co-sponsor legislation. And one of the main duties is providing oversight for city agencies, investigating citizens' complaints about city services, and making proposals to address perceived shortcomings or failures of those services. In their statement, Williams said, quote, "The data we see today confirms and reinforces what we've seen over years and decades of systemic inequities. These ingrained injustices have always been there, often ignored by many in power. But these numbers show the harsh truth. The bias has a body count. From both the city and the state, the data released consistently shows that New Yorkers killed by COVID-19 are disproportionately Black or Latino. In New York City, over 60%. But even these statistics are incomplete and undercounted. City data shows that it's as high as 37% of fatalities, race is unknown. As I've said, we need to know the racial breakdown in rates of testing and of positive confirmed cases to find and correct these clear failures. The coronavirus may not discriminate, but the response, or lack of a response, clearly has." Williams goes on to conclude in their statement, "And in our response to and recovery from this pandemic, we need to do the hard work of addressing the injustices and inequities in our system that we have been further exposed and exacerbated by this crisis. We cannot sanitize a history of neglecting communities of more color, cannot mask the resource inequality and inherent biases that spurred the spread of the virus, cannot undo the human cost of these failures, but now we can work to strengthen communities and save lives." In the midst of the COVID-19, communities of color have been disproportionately impacted by this virus, this pandemic. And in particular, according to an article by Kenya Evelyn at The Guardian that came out on April 8th, titled "It's a Racial Justice Issue, Black Americans are dying in greater numbers from COVID-19. Evelyn discusses how in Chicago, which is 30% Black Americans account for 70% of all coronavirus cases in the city and more than half of the state's deaths. In Detroit, which is almost 80% Black, it has the most concentrated coronavirus cases in the state of Michigan, and more than the death rate in the city accounts for 40% of overall deaths in the state. We want to kind of discuss some of the reasons behind this through the critical race theory lens. Some of the reasons that Evelyn provides is that there's a healthcare desert, which, if you're unfamiliar with that term, healthcare desert essentially means areas with few or no primary care physicians. Experts have also pointed out that the initial research showing a high prevalence of COVID-19 among those suffering from obesity, high blood pressure, and diabetes. These are risk factors that are more common among Black Americans. The virus is known to take a harsher toll on those with underlying health issues, and many hospitals are only testing those admitted for critical care. A couple other reasons, just real quick, is also only 20% of Black workers reported being eligible to work from home, compared to about 30% of their white counterparts, according to the Economic Policy Institute that they cited. Mm-hmm. And what it really comes down to is when white communities get sick, this is quoting a state representative, David Bowen of Michigan. Correction, this is the first Wisconsin lawmaker to be diagnosed with the virus. We in the Black community are threatened to die from the same sickness with lack of health care, often leaving us to self-diagnose. So we want to kind of discuss the legacy of systemic racism that has really exacerbated the impacts of this pandemic here, specifically for communities of color.
So if I may make two comments about the public advocate, and I would love to hear people's opinions and thoughts about this, but there's two things that bother me about the situation. Multiple things that bother me about the situation, but this one specifically is that, and we've seen this time and time again, where it is not just New York, it is not just Detroit, it's not just Michigan. Everywhere where we look, states and federal government, they're not releasing the identity of who are those impacted mostly by COVID-19. And so it begs the question, why is it that governments are not releasing that information? Then it made me question too, why is the public advocate is the one releasing the information? This person is, I want to thank this person for releasing the information, but New York has elected officials, people that have been voted by the community, but they're not the ones coming out and saying, hey, we see that Black folks are being more affected by the situation, and here's what we want to do to solve that. It has to be a non-voting member. Why is that the public officials are not coming out and owning the situation? And I think it goes back to that deep-seated racial inequalities that we've been talking about, that you mentioned in that article.
Yeah, I think this really speaks to the critical, I think we can better understand this with the critical race theory component, which is whiteness as property. Specifically, whiteness as property, it claims that whiteness as an intangible property interest. It speaks of how the legal system protected a vested interest in white skin. And therefore, whiteness automatically carries with it greater economic, political, and social security. I think there's something to stress here that history is a long and connected process that isn't severed at all. So the present is connected to the past, and it will influence and has influenced kind of trajectories of where we're going. Essentially, that historical legacy of racism, what I mean by that is systemic oppression and inequity, has continued and continues. I think the value of using critical race theory, specifically this concept of whiteness as property here, is really to better understand the rationale, as you were saying, why it's always kind of been this way, why it continues to be this way, and why it hasn't changed. Essentially, these are structures of white supremacy that have been put in place and continue to be in place, and therefore they protect whiteness, and hence we can ask questions like, why are healthcare deserts a thing, but let alone why do they exist predominantly in non-white communities, basically in communities of color?
Mm-hmm. There's the other thing too about just like I know in Chicago, I forget the term for it, but there's convenience stores or like grocery stores, you know, they're not as abundant.
Food deserts, yeah.
Food deserts, yeah. So it means that when people do have to go to the grocery stores in this, I mean, always, but particularly in this predicament, they are all, like everyone is in the same spot, packed together. I mean, it's already hard enough, like right now, when you go to the grocery store, you know, because people don't have work or they're working from home. So there's a lot more people in the grocery stores at all hours of the day. But when you especially have one grocery store for miles and miles and miles and miles, you're just packing people in to one space. And, you know, and that on top of the fact that, you know, you don't have medical workers readily available also in that same space.
Yeah, absolutely. Yeah, just to go off further to that food desert point, like imagine, like, well, I don't even say imagine. I mean, the situation for many communities is that you go to the liquor store to purchase, you know, fresh.
Yeah, quote unquote, like, fresh
produce.
Yeah.
Yeah. And so the point being here that like lack of proper access to what would otherwise be available in other communities.
It's a continual lack of access. It's like you're saying, it's not a new thing. It's just a problem that has greater consequences in this moment.
If I may add, and I think it was something that I think all of us in our conversation are alluding to, is the concept of intersectionality in critical race theory. So for our listeners out there, so intersectionality, coined by a scholar named Kimberly Williams Crenshaw, and so she's out of I believe somewhere in California, in one of the schools there. But she stated that intersectionality is the concept where people's identities combine to create something larger. And so so when we talk about African Americans, Black folks in New York and Michigan and Chicago, it is not just their race that intersects, and it's not just their race that comes and complicates their situation. It is all those other identities that they have. So we're talking about here people that have low socioeconomic status, so they might struggle to find the already diminishing resources that dominant society has created or made available for them. We're also talking about folks that cannot afford to stay at home and wait this to pass, because if they stay at home, they don't have anything to eat. They don't have ways to support themselves. And we hear about the federal government passing this stimulus package that we don't even know when it's going to get there. And if you really think about it, how much is $1,200 is going to help in places like New York and Chicago? I mean, I don't know the exact numbers, but rent is expensive. Cost of living is expensive. And so all these things that we talk about, all these things that we've been talking about so far is those multiple identities, intersecting identities, tend to complicate the situation a little more, a lot more, I would say, for the individuals that we're talking about.
Yeah, I think this issue comes up in just how people are treated by healthcare too. I know, like, thinking of women of color particularly who go in before the pandemic, but also during it with symptoms, and I think are just often dismissed as, I actually have a friend who's a white woman, but who was told that she was just having a panic attack, went into the ER. She's tested positive for COVID-19 since, but just that total disregard for a person to know their own body is really exposed, I think, particularly during the pandemic. And so again, that intersectionality of how people are treated based on race and based on gender is coming to light more than ever.
Absolutely. I think that ties really well in with the next critical race theory component, which is interest convergence. So interest convergence, according to critical race theory, was kind of coined by Derek Bell. And this was in the context of the Brown v. Board of Education, but really we could utilize this into other areas. And I think it does a really superb job of examining the interests of basically those in power, the elites, the dominant discourse, etc. But according to Derek Bell, Bell had said the interest of blacks in achieving racial equality will be accommodated only when it converges with the interests of whites. And this wasn't something that is necessarily like talked about just for CRT, critical race theory. Even Malcolm X was talking about it. And also it's also kind of understood not just as interest convergence, but also kind of understood as white self-interest principle. But Malcolm X in 1964, when talking during the time of the Civil Rights Movement, he was discussing white Americans. He wrote that, quote, "They don't try to eliminate an evil because it's evil or because it's illegal or because it's immoral. They eliminate an evil only when it threatens their existence." And so I think to tie that back, there is a diminished or even lack of interest convergence for basically removing like food deserts or healthcare deserts. There's actually an interest convergence with having inequity, right? It supports the white supremacist institutions that are currently and have held long in place.
I think it also, in a way, supports capitalism.
Absolutely.
Not to go off topic, but just...
No, it's connected.
Yeah.
It's... Yeah. It's because like one of the things I feel like... Oh, no, go ahead.
Go for it.
Well, I was just going to say that one of the things that I have noticed with all of these issues coming up right now is that I see a lot of, what I kind of call like white liberal tears on the mainstream media, where they go, "Oh my God, I can't believe this is happening." And then, then they have a little frowny face, and then it cuts to commercial, and then that's kind of it. That's sort of all you get.
Yep. Oh, they did a black and white montage of like people taking pictures of what it's like being, to quote SpongeBob, inside during the pandemic. And there was like one with like a little like baby, and you could see like a black and white, baby booty. And like, it looks like everybody's just, staying inside and being healthy and safe and having fun. And it just seems like a very like white, like liberal, like idea. And didn't Cuomo, like, correct me if I'm wrong, we need to like fact check this, but I heard that Cuomo and like New York City, everybody has like a free subscription to like that meditation app. Is that like the answer to like mental health during all this? Is like, just meditate. Yeah. That's all you need.
It's hard, all these recommendations. And then I think with that, the thing that's really concerning is there's all these recommendations, stay inside, eat well, exercise when you can, as if you live in a place where you can, like go to the sidewalk and be 6 feet apart.
Right.
And just the scorn when people don't or can't follow that. I think it just pairs with this kind of self-righteous, like, ignorance, in sometimes cases well-intending, but also just like a total, I think, disregard for other people's realities. Yeah.
Yeah. I think it definitely takes, it comes from a perspective of whiteness as like the default, and then like and says like, do this. And it's like, basically what Williams was talking about, like there's so much inequity for communities of color that it's kind of ridiculous to ask some of this from the communities when they don't have access to these resources and historically have been disenfranchised and oppressed. Let's be real here.
And like you said with I forget how you phrased it, liberal white tears? Is that the coined phrase? White liberal tears. I didn't get the word right. But just this, like I've heard the term crisis of pity. Just this whole like, oh, that's so sad for those people. And just like this very top down kind of response. So how to be more, I don't know if compassion is the word, like to recognize how our identities are like intertwined in a way. It's not just this separate group of people who have nothing to do with me as a middle white class person. So how to like have that connection, I like the term like simultaneous identification and disidentification with the other, like but to at least have more than just sorry to offer.
Right.
Yeah.
There's it's sort of like what's the phrase, part of the course for especially media pundits to kind of like just touch on things but not really address things and not really make it so that the public is actually fully informed in a way where change can actually happen. Like, examples like, when the news, when they show, oh, there's this, poor black boy who had to walk, 6 miles to school, and then someone, decided to give him a car, and it's, he did that for 2 years, and, it's sort of like the celebration of him trying to go to school regardless of his situation, and there's no dissemination of why did he have to do that in the first place.
Yeah, and this myth of meritocracy, isn't that part of CRT too? Like highlighting the stories of the rags to riches. Like if only you try hard enough, this will happen to you.
If I really quickly, I want to go back to this concept of change. So earlier I was reading an article by Milner, Pierman, and McGee about interest convergence. And I found a quote that I think connects really well to this, but also made me reflect a lot in the current stage where we are. But they said, change is often purposeful, skillful, and even subconsciously slow, and at the will and design of white people, those who make up the rules historically and change them as they find them necessary, depending on what is necessary for them to maintain their power, their perceived dominance, and their status quo. And so I don't think until white folks start dying, we're going to see a change in how in how the COVID-19 is addressed. Right now, going back to like this pity sort of like concern for people dying, but there is no actual actions. There is not actual things being done that will address their situation.
Yeah, I think that's like an accurate observation. If it was white communities that had lack of access to healthcare, lack of access to like healthy and affordable food, lack of access to, really it's our basic human needs, you would see that shit change so fucking quick. And
middle class white people, I think, because there's that intersection as well.
Absolutely.
Basically more Tom Hanks. We need more Tom Hanks cases.
Who didn't even run a fever, as I have heard.
Oh, wow.
It was an anomaly.
Wow.
Must be nice.
There's a quote I really like from, it's called The Undercommons. It's by Stefano Harney and Fred Moten. And the quote I love is, they're talking about just the white man's burden. Like, I want to help because I have pity. I don't need your help. I just need you to realize that this shit is killing you too, however much more softly. And I try to think of that, how it's not to say like, oh, we're all in the same boat. We're all the same. We're all in this in the same way. But to say like, we are not exempt.
Yes.
So to still have some kind of, I guess that is kind of the interest convergence of like, could that be used strategically, I guess? But
yeah,
we're
the
not
phrase we're all in
it.
this together it's sort of tone deaf, similar to the Imagine video by Gal Gadot.
Oh,
because it's just not true. We're not all, we're not on the same page. We're not all in the same situation.
Yeah.
That reminded me, sorry to butt in, but it reminded me, I don't know, did you see how Madonna was talking about the great equalizer out of her bathtub?
Out of her bathtub?
Like she was taking a bath, and she posted a she posted an Instagram story saying how COVID-19 was the great equalizer, and that if anything, it had made everyone equal. Obviously, for obvious reasons, that story didn't stay long on Instagram, because everybody just be like, hey, how can you speak of the great equalizer when you're a rich white person taking like a bath in like what appears to be like some like
milk water with like rose petals floating around.
Oh wow.
And that, and then two is like COVID-19 is affecting people differently. It's not like it's not. If I find that, I'll send it.
Yeah, I almost feel like it should have stayed so we can critique it. I hear that though, like this is the disease that doesn't discriminate, and yeah, that's what I hear most often. Like it's an equal opportunity virus.
It kind of that really reminds me of like that's some serious like drinking of the ideology to like make that claim, like totally be like, oh yeah, it's totally ridiculous. It doesn't care about what color you are. It's just indiscriminate. And it's like, that's totally overlooking basically what CRT's saying, and what Williams was saying here is that there's this historical legacy of inequity, meaning you got like, not you, but like the system, you know, our society, the United States of America, really the world, but like United States of America that we're focusing on, these disproportionately, like communities of color are at a huge disadvantage because of access to resources, right? Compared to white communities in particular. And so it really overlooks like the systemic oppression. She's not planning to sell her bathwater like that one streamer e-girl, right?
She was selling the water.
I mean, I'm pretty sure that if she were to offer it, I'm sure there will be people buying it.
That's like some Gwyneth Paltrow shit. Like
that's what I was thinking.
Give it a nice weird name. Like, what is it? Goop? Is that her thing? Title?
That's her like company, isn't it?
I think so.
That sounds bland enough for her.
Give a sexier name to the bathwater. You know. Go ahead.
At least try. Use some of that creative energy. But going along with what we're just talking about, how this affects all of us differently. Like, I kind of want to move on to the the ICE, immigration, how COVID-19 is affecting border camps, and also jails too. So on April 3rd, Democracy Now's Amy Goodman interviewed Laura Molinar. She is the founder and executive director of the group Dreams Without Borders de Tejas. Sueños Sin Fronteras de Tejas, a Latinx woman of color-led collective providing support to immigrant and asylee women. I didn't know that was a word, actually, asylee.
I think it's like
children,
the plural.
That makes sense. Children and families in South Texas. They discussed how detention facilities are spaces where COVID-19 could spread with catastrophic outcomes. Thus, there is a call for releasing detainees, and these detention centers ought to be shut down. During this interview, they discussed that as of April 10th, on the ICE website, there has been 61 confirmed cases in ICE custody. Some may have been released. 19 confirmed cases among ICE employees working in ICE detention facilities, and 67 confirmed cases amid ICE employees who are not assigned to the detention facilities. And on April 8th, Ashoka Mukpo, I hope I'm pronouncing that correctly, staff reporter for the ACLU, released an article on how 80 people housed at the Tacoma, Washington facility have gone on hunger strike to raise attention to the danger they say they face from the pandemic.
Yeah, this is like another element of communities of color that are highly at risk because of the confined spaces, but also the lack of treatment, basically from the state. Let's be real here. The state is intentionally not providing resources to help those that aren't either protecting or benefiting whiteness. When it comes down to it, through a CRT lens, when I was reading this article and watching the clip you can see on democracynow.com or .org, I was thinking about how this connects to interest convergence, this CRT topic. And it remembers interest convergence is about change doesn't happen unless it benefits whites. I think that there's, again, a lack of interest convergence here. The only reason I could think of potentially would be it would be protecting ICE agents. So like releasing detainees would, I don't know, somehow like lessen the risk of ICE agents getting COVID-19. That'd be the only reasoning I could think of that it would benefit whiteness here. Otherwise, it would benefit them to keep them, locked up, keep them detained.
Yeah. It's like right now, I guess right now in Sweden, apparently their way of dealing with COVID-19 was to only have to not completely shut down, but to instead only allow those who were less at risk to contract the virus or at least be affected by it, to just go about their day as normal. Of course, that hasn't worked out well for them. They're now reporting like a spike in cases because, as we know, the virus, it's a virus. It spreads. You can have the virus and not know it, and you can give it to somebody. You can touch a surface and leave it there, and someone can pick it up. It's amazing to me how we have to, go over basic science that we all learn in high school about how diseases and germs work throughout this, because as ICE, you have these detainees who should not be detained. You have ICE still, it's not an essential service. It should not be in there. But there are people who believe, I guess, what they're doing, so they keep working their jobs as ICE officers, but like kind of like we're saying, as the disease spreads and as these agents get infected, maybe then the virus will perform action for us, but it's just one of those things where, why does this have to happen? Why do people have to die? Why do people of color have to suffer? Because this is a race thing, but this isn't a race thing in the sense that this is just pure like science. This is going to kill everybody. Like, you can't pretend that, I'll just forget about you because you're brown, so I don't have to think about it. Sorry, I'm going on a tangent here, but it's just, I just don't understand how this is not like something that hasn't raised more eyebrows. And, like a lot of people have been saying this, like ICE is not an essential service. It should be shut down. ICE never should have existed in the first place. But this whole idea of like trying to maintain these people in these conditions, these already bad conditions, but like, the idea that, we should keep up this job that doesn't need to be. And then also, now it's weird because now I sort of feel bad for the ICE agents because they're also going to maybe die from this stupidity.
Well, if we go back to, I don't know, a few months before COVID-19 was even on our radar, there were multiple examples of children dying of diseases in the custody of ICE. I don't remember if you recall, but there were a few from Central America that were in custody in ICE, and they either didn't receive the proper medical attention or they received it late or whatever the case might be. But call me naive or whatever, but I think people, undocumented immigrants are going to keep dying in detention facilities of COVID-19 or whatever else comes along, and they're not going to be released. That's just me. And then the other part too that I want to go back to, interest convergence about that maybe if ICE agents start dying, maybe they'll release undocumented immigrants. But then I thought about is like, how does how much does American dominance cares about ICE agents? They're like the disposable part of the enforcing arm of immigration. They are just tools of American domination, and if they start dying, they're gonna keep replacing them. But I don't think that is the type of white folks that American dominance cares about. There is even with like whiteness, there is this hierarchy of what's white and what matters the most. And I don't think ICE agents matter that much to
and
American
who are
dominance.
we protecting? I think that's been coming up so much with, or what are we protecting? I mean, ageism is another part of this intersectionality, and even though we know that it's not necessarily true, we can't necessarily know who's a vulnerable population or who isn't vulnerable as much, because it can affect anyone. But just this idea of sacrifice, I see come up so strategically and in really troublesome ways. Like Lieutenant Governor, Patrick, I think Dan Patrick in Texas, basically said, like, you know, if I had the chance to lay down my life to protect the America that my children love so much, I would do it as an elderly person, he said. But just this idea of you can, like, you're expendable, black bodies, brown bodies, older people are expendable. And then when they die, their legacy will be carried on as sacrifice for the war of the U.S. economy. I hear that. And I hear people rally behind that. And I think it's really, like, it's so blatant that we are caring about labor and capitalism and whiteness over lives, but somehow it's still appealing to some. So,
I mean, hot take here, maybe a little too hot take, but hot take. What was the governor, Patrick? Just go for it. Go outside, stay outside, do your thing.
He's the lieutenant governor.
Yeah, you know, do your thing. Nice to know you.
Yeah, that's the whole thing. Is there's the people who are speaking the loudest with this my mentality. It's just like, oh well, what's the phrase actually?
It's truly a capitalist death cult.
The philosopher Alan Watts had this thing about when someone is convinced that the Earth is flat, you should go, oh, okay, well, why don't we go visit the edge of the Earth?
Yeah, step off it.
Aren't these some of the same people who are talking about or so concerned about like death panels for like Medicare for all stuff?
Probably.
Yeah. Yeah.
And the fucking Supreme Court, who says from their remote decision that Wisconsin voters need to show up in person.
Oh my God. This country's truly a death cult.
It's kind of like, so I watch Survivor, which I hate that I watch because it's the epitome of everything wrong with the world. But Jess fucking Probst, who loves to like berate the survivors in their challenge and tell them what they should do and give them advice. And I'm always like, you do it. Like I would like to see how long he lasts. But I think it's still like the people making these super righteous claims are the people who are middle class or upper class and are saying this from Zoom behind their computer in their $1 million home. It's just...
Yeah, these are the people that don't have to leave their house, that if they get sick, they can just walk into a hospital and get the attention that they need. Absolutely.
Yeah, or even like hire like a, I don't know, like a medical...
Insta shopper.
Yeah,
Personal
you can
doctor.
Instacart like a doctor to you.
Yeah.
Fast and flexible, please.
I do want to, since we're in the topic of interest convergence and what a essential worker is, and since we were talking about immigration, I saw an article this morning on NPR. So as you know, farm workers are one of those segments of the population that have been deemed essential workers. And throughout this pandemic, they have been asked to continue working as if nothing is happening and with little to no protection whatsoever. And so I came across this article. So the title of the article, it says, White House seeks to lower farm worker pay to help agriculture industry. And at first I'm like, well, how low can you get? Are they gonna start paying for working now? Because like they already get shit for work. So if you're familiar with how farm workers work, they don't get paid hourly. They get paid by how much they collect, how much they harvest. And so I have many students that their parents or themselves do that. And they already have to struggle to earn some money. And now we're at this point where let's bring some farm workers from other areas and let's pay them less. And so that reminded me of again, interest convergence, because if we weren't in the situation where white Americans are dying because or don't have access to proper food, we wouldn't be looking at importing cheap labor from parts of Mexico and Central America. That wouldn't happen. And then two, the concept about intersectionality. These are folks that are undocumented or folks that already are at low socioeconomic status. And so they will get impacted more heavily than folks that are middle class and non-white.
Yeah. And I think isn't even that stimulus check that Trump is supposedly going to send out to everybody, there's limitations of who can get it. And a very large portion of our labor workforce, undocumented workers, they're not going to, from my understanding, many, if not all, but many at least will not.
Yeah, you have to have a valid social number to get the stimulus check. And even if you have a valid social number, you have to be a, what do they call it, non-resident alien or something like that.
I thought I saw on the IRS website. I might be wrong. We'll have to double check.
It was there. It was in the IRS website.
Okay.
Yeah.
Because I saw also if you file these certain forms and a couple of them were NR and it means non-resident, you're not able to get it.
Yes. But, right.
Frustrating.
Yeah.
That's just all of this. Again, these are things that have been issues. They're just heightened issues. And, of course, along with all of this, there is also the rise of hate crimes and xenophobia.
Yeah.
Real quickly, I also wanted to say I think just yesterday as well, just to top off this whole topic, the Surgeon General told America in a live briefing, he told, when he addressed the issue of people of color being disproportionately affected by COVID-19, he advised that people of color should avoid alcohol and drugs to protect themselves against the coronavirus. What? Surgeon General Jerome Adams, he said...
I found it. Yes.
Yeah, he said, we need you to do this. If not for yourself, then for your abuela. Do it for your granddaddy. Do it for your big mama. Do it for your papa.
What?
Yes, it's a thing.
Can white people use drugs and alcohol? Is that okay? Is that
well,
the
he only
inference?
said black people, so
yeah.
See, liquor stores and dispensaries are only what is it called? Essential businesses for white people. And if you're a person of color, don't do any of that.
Wow.
Yeah, he kind of tried to walk it back by saying, I didn't mean to be offensive. I was just saying, what was it? Everybody should absolutely avoid alcohol, tobacco, and drugs. And that language like Big Mama was not meant to be offensive. That language is what we use in my family. But if you watch the video, it doesn't sound like that's something that he says. He sounds like, when he's saying these things, he sounds like he's never said these words in his life.
Weird.
It's very he's also just an uncomfortable person to watch. So,
Sounds Sounds like it.
But yeah, so that's just the start of this whole topic about the rise of hate and xenophobia. There's a lot of, a lot of stuff people probably already know now with the, where do we start? The Chinese virus, the Kung flu.
Oh God.
That Trump throws around.
And when questioned, he's like, no, it's not a problem, and deflects and is like, you're a terrible reporter. Shame on you.
Yep. I don't think it's racist at all. Nope. I think, what do you say? I think Chinese people will agree with me because it comes from China.
And then there's people like Alex Jones, who is just like basically supporting that idea and then saying like, yeah, the Spanish flu came from Spain. It actually didn't fucking come from Spain. Like, that's bullshit. So
again, we know there's racist people in the world. It's just, somehow it is a little bit shocking that it's like magnified, that people have, I guess I don't know if part of it is like people are just so scared they need somebody to blame, and so they're more willing to buy into the racist stereotypes and things like that just to make themselves feel better and have a sense of grounding in all of this. It's really baffling to me that people like even choose to be racist or xenophobic at a time like this, because again, this is a virus. It had nothing to do with race or religion or anything like that. It's gonna get you if it's gonna get you, regardless of what you believe. So, I mean, it's just like, I haven't come across anyone like this personally in my life, but when I see the arguments and the things that people are saying, and buying into what Trump is saying and his administration is saying, and the kind of phrasing they're using, it's like talking to children and trying to get them to calm down and trying to just be like, again, like I try very hard to go, how can this make sense? How is it somebody does this, chooses this? You want to be like, don't do this thing, don't do this racist thing you're about to do, please don't do this. But I don't know, I'm kind of at a loss for words right now, because I just so like appalled, frustrated, angered, and just
Mm-hmm.
It's just the height. I don't know if it's the height. It's hard. I don't know where the peak is. There's just so much stupidity involved in this as well.
I do think, to make it clear though, like, and tie it back to Williams, that we talked about earlier, the statement about inequity. It's not just individuals that are racist. Like, it's definitely like a way to not look at the overarching problems that continue to perpetuate it.
Mm-hmm.
Yeah.
The racist systems.
That's true.
Right, the individual choices discourse. I think there's still this, like, thinking again of all the intersections. People want like good people and the market and the DNC to save them. Like,
oh God,
none of that's going to happen. Or maybe collective good people, but it's not.
Yeah, I guess I have little faith in working within the system in that way of like,
yeah.
At least if you're not in, what was it, Wisconsin, it's not, it's vote or die, but it's like vote and die potentially instead. But maybe it's too dark. But there's definitely a lot of calls to action that are going on currently, even in the midst of the COVID-19 pandemic. There's general strikes, rent strikes, labor strikes, just to name a few, such as if you check out Black Agenda Report, they're calling for a general strike of no work, no shopping on Friday on May 1st, as well as Non-Compete, which is another leftist group.
BreadTube.
Yeah, basically that's connecting in with BreadTube, with American Johnson and Luna, among others as well. But they're calling for a general strike, and they have a website set up, and they're collaborating with a multitude of various organizations. But you can check it out at genstrike.org. That's GENSTRIKE.org. Hopefully we can have them on, or we can go on their platform and discuss it further. But in the midst of this too, like, we definitely want to call the need for building community, nurturing relationships, mutual aid, but also direct action. And there, like I mentioned, there's a multitude of various organizations and resources. A couple in particular, the Mutual Aid Disaster Relief Fund. Definitely, if you're able to support them, as well as what's going on in New York with Rikers. There's a large prison that is inevitably going to cause, I mean, it's basically a death sentence and potentially. And there's an emergency release fund specifically for the trans community to essentially like get them out of there and protect them. So if you go to emergencyreleasefund.com, you can support saving lives.
Yeah. So if you check in, the DSA has a lot of local chapters.
What's the DSA too?
Oh, DSA, Democratic Socialists of America. You just go to, I believe it's dsa.org. Nope, that's not it.
We'll put a link in the comments for that.
Yeah, put a link in a comment. But the DSA, they have a lot of chapters. Oh, was it?
It's dsausa.org.
It's good because it rhymes. They have a lot of so they've been doing a lot of outreach to local communities, putting together a list of people who are available to either do kinds of grocery shopping type of stuff, like whatever kind of help. They've been really working hard to get like a roster of people who can volunteer or help with whatever they can do. So if you're also just trying to find out like how to help out in your local community, DSA is a really great place to reach out to, try to see if there's a local chapter. And then just contact, the first person and just say, how can I help? They'll be sure to get you in the right direction.
I'd also recommend personally, if you're interested in labor and calling for, general strikes, but also unionizing, organizing, and building co-ops in your local area, to definitely also check out IWW. That's the International Workers of the World. Basically calling for a general union worldwide for like all workers, which obviously is completely antithetical to the whiteness and interest convergence there, just to tie that all back together.
Mm-hmm. Another fun thing to do is create an anonymous Twitter account and then just find the local representatives or people that that are in elected office, and then just tweet "you racist asshole" or something of that nature to them. It's not exactly effective, but it'll make you feel good.
Maybe a little effective. We could pretend.
It's definitely self-care for me.
It's definitely self-care.
This is just like a side note. Is there anything else we want to talk about, or should we like wrap up the episode? We're already at an hour, I think. Ray, did you had the video clip of like the lady in the bathtub? Did you want to comment about, like, play it and we can comment about it?
That's the thing about COVID-19. It doesn't care about how rich you are, how famous you are, how funny you are, how smart you are, where you live, how old you are, what amazing stories you can tell. It's the great equalizer. And what's terrible about it is what's great about it. What's terrible about it is it's made us all equal in many ways.
It's made us all equal?
I missed the part where it was Madonna when you first mentioned it. And now I'm like...
Oh, me too.
Oh. I wonder what her net worth is, too. Like,
I want to know what bath thing she used.
You want to buy that?
I need a jar of her
Madonna bath.
What?
Like that water. Like,
Did you hear about that? You know about that, right?
Who was it though? I forget who it was. That was selling their dead skin particles in warm water. That's no longer warm.
It's called raw water. Okay, it helps me build my immunity.
The that Madonna video pretty much to me personifies the white liberal tears.
Literally, they kind of look like tears. Yeah,
it's true.
Yes.
So that's it for this episode.
It's a good note to leave that
on. Thanks everyone for listening. So that's been our episode on critical race theory and COVID-19 and bathwater. Please, reach out to those sources that we mentioned. We'll have links for you guys to help out where you can. Stay safe, stay sane. Try not to consume too much media if you can. News media, I would say. If you've listened this far, I would say this is enough to probably get you going for a good while. This is a pretty healthy dose, I think, of information. Bathwater. Really want to emphasize that while we're not technically all in this together, you're not always alone. There are people who will help you, and people who will listen to you. So do reach out, do what you can, take care of yourself, and we will talk to you soon. Bye.
Bye.
Public space travel.
Don't worry, buddy. You're doing fine.
Public space travel.